Hi, today I would like to talk to you about some devices that are used in the medical field. There are a variety of tools used in the medical field to obtain critical information to better assist the patient. Today I will be sharing with you three of the most commonly used tools in the medical field. The three items I'm going to show you, first thing being a stethoscope. The second is going to be a sphygmometer, and it's also known as a blood pressure cuff. And the third tool I'll be showing you today is a pen light. First, I would like to show you what a stethoscope looks like. So a lot of times in doctor shows, or Grey's Anatomy is one of my favorite shows, you see these doctors walking around and with these stethoscopes. Nurses have them as well. The stethoscope is one of the hallmark types of tools that they use. It's very classic. So this right here, you can actually see where you can flip it to turn it on, and that turns it off right there. Before you use a stethoscope, you actually want to make sure that the placement is correct. So if you notice here, see how these little earpieces right here are pointing outward. So that would be the correct way. You'd want to place these earpieces right into your ears to get the best auscultation, which is another word for listening. And this little piece right here is your diaphragm, and this piece right here is your bell. So if you've noticed, you've probably been to the doctors before, and they place it directly on your chest where it's cold. The good doctors and nurses, they remember to warm it up for you before they put it on. But this tool is actually used to listen to heart sounds. It listens for any irregularities. It's also used to listen to any of your lung sounds. They'll listen down here as well. And they'll also listen here on the back of your lungs. And then another main thing that the stethoscope is used for is actually to listen to your bowel sounds. There's actually 4 different quadrants that they'll listen to. And that's very important to hear, so that way they make sure there is movement going on in the GI tract. So the stethoscope is very widely used for that. Secondly, I'd like to show you this is a blood pressure cuff here. Now what I'm showing you is the manual blood pressure cuff. This cuff is mainly used whenever there isn't one of those nice the manual machines where they put the manual blood pressure cuff on you, push a button, and it does the work for you. This one, however, you actually have to do it on your own. You have to do it manually, which I really do enjoy this one. Here you can see the measures. There's actually different numbers here that indicates the arterial pressure, which is the blood pressure that you receive. Here's your balloon pump. So this actually blows up the cuff itself. And then right here, you have a little tool that you can tighten it, and then you release it to let the pressure go. So this one's pretty neat. Again, the blood pressure, normal blood pressure is between 120 to 80. That's your normal blood pressure. Hypotension, which is anything that is higher than 120 over 80, and hypotension, which is going to be a blood pressure reading under 120 over 80. And lastly, the tool that I want to show you is a pen light here. So this pen light is used for a lot of neuro checks. A lot of doctors will have these, nurses will have these as well. And you can see here that there are different pupil sizes. And if I get it a little closer, there we go. So what we're looking at when we actually shine the light right into the patient's eye, is we're looking at the pupil size. Are the pupil sizes, are they the same? We're looking for the equalness. We're also looking for the shape of the eye. Is it perfectly round, just like it shows here? And we're also checking to see, is it reacting to light? So if we have one pupil that's constricting and one that's dilated, which would be open, are they the same sizes, or are there any abnormalities? Things that could trigger this could be any type of masses. This is just, an over outstretched, exaggerated example. But really for this is the smallest tool that I'm showing you, but this is actually the most important because it's actually looking at the back of the brain. The eyes communicate with the brain. So if there's any abnormalities that shows on this pen light that you're doing any medical examinations, that can indicate any other underlying issues, which you would need to get addressed immediately. So today I just want to go over a brief rundown. Today I talked to you about 3 medical devices that are used throughout the medical field. The first one was the stethoscope, the second was a blood pressure cuff, and thirdly was the pen light. I hope that you enjoyed this video that I showed you today, and I hope that you learned something and that you take something away from this. Thank you.